Last year, over 38 million kids under the age of 5 across the globe were labeled as fat. That's either overweight or obese. These kids are at risk of never fully developing emotionally and physically because of that childhood obesity. In internal medicine clinics like mine, obesity problems have been filling the medical charts for a couple of decades. But over the last handful of years, pediatricians have now been adding these chronic medical problems related to obesity to childhood medical charts. That altered body chemistry from childhood obesity will prevent these kids from experiencing that perfectly wired brain and the fastest repairing body that they'll have in a lifetime. If they fail to hit that peak maturity during this developmental time, they will never have a chance to reach that again in their lifetime. Recently, the ketogenic diet has been slimming waistlines and reversing medical problems in adults, which has brought about the question, can keto help kids? Let me show you what I recommend. The first place that I recommend the ketogenic diet is when their parents show up in my clinic with obesity-related problems and their kids are following them in size, shape, and habits. Yes, these kids present to their pediatrician with adult obesity-related problems like high blood pressure, cholesterol problems, fatty livers, polycystic ovarian disease. They have bone structures that aren't developing properly, and they're all related to obesity. Unbeknownst to them, their way of eating has failed to deliver nourishment, and not because their foods weren't fortified. In fact, most of the processed foods have been labeled as fortified, tricking them into thinking they're nutritious. But what those foods really did was stimulate an excessive and abundant amount of insulin over and over and over again. This obesity related to high insulin shifted their chemistry set. And those fat-based hormones that should be delivered to their organs and help their bones grow are now trapped in their fat cells. If we want to reverse these medical problems in kids, it isn't a lifetime of prescription medications. We can reverse the problem in these kids because these chronic health problems that plague many of the patients in my clinic have only been going on for a few years. Shift the problem at the root and change how they eat. For kids suffering with obesity, I do recommend the ketogenic diet, and I tell them to have no sugars, no fructose, and no processed food. That includes bread. A low-carb, high-fat, ketogenic diet has proven immensely positive in kids. So I do recommend the ketogenic diet for kids that are overweight or obese. I tell them a mild ketogenic state where they hit a state of ketosis about a half a dozen times in a week will serve them well. And within a few weeks, they will have increased energy, increased mental function, and that weight will come off. Now let's advance this conversation and the ketogenic recommendation. The second place that I recommend a ketogenic diet in kids is those suffering from autoimmune or inflammatory disorders. Although obesity may not be in their charts yet, when they graduate from the pediatrician to the internal medicine clinic, the weight problems are almost always associated with these autoimmune problems or inflammatory problems. Autoimmune problems happen when their bodies accidentally start attacking themselves. And this mismatch of their immune system starts out with a low chronic state of inflammation and grows over time. Their immune system starts doing things it shouldn't, and it misfires. And this leads to diagnoses like psoriasis, rheumatoid arthritis, lupus, and even thyroid disorders. These problems of autoimmune will grow with age and destroy these organs altogether if you can't stop it. The current approach to taking care of these kids is to use medications that shut down the inflammation. These medications include steroids, chemotherapy drugs, and the ever so expensive immune modulating drugs. Although these really advanced medications offer the privilege of this advanced science, the long-term effects of these medications will change the trajectory of their health forever. And they pack on the pounds. Just like those kids of obesity, those added pounds will siphon in those fat-based hormones and they will fail to hit peak maturity in both their bone structure, their endocrine structure, and their brain. The roots of these prescription medications centers around reducing the inflammation. And that's why the ketogenic diet offers such hope for these kids. By adding a ketogenic state to these advanced medications, it gives them the best chances of reversing the problem and shutting off this disorder forever. In these kids, I don't ask them to just dabble in a state of ketosis. I instruct them to get into a state of ketosis and stay there consistently for several weeks. It is in this situation that they're able to wring out some of those chronically inflamed tissues throughout their body and find their body return to a more normal state of development and repair. I do recommend a very advanced or strict ketogenic diet for kids who suffer from severe problems like seizure disorders, type 1 diabetes, and some cancers. But that's a conversation for a different day and a much longer video. If you want to see how I bet my teenage son that if he did ketosis for 2 weeks, his acne would go away, check out this video. I'll see you there.